We're working harder than ever before on the health of our employees. We're aware that we work very much on construction sites. They can be dangerous places, and part of our responsibility as an employer is to try to manage the work we do, manage the health of the employees and manage their safety, and we take that very seriously. For every safety incident at work that results in a death on a construction site, typically there'll be 99.4 health-related deaths relating to construction sites. We're looking today at breathing-related problems, so whether we come across any dust in the job that we do, hearing-related problems, vibration-related problems.
We wanted to bring professionals in to focus a lot more on health, not just health risks where we could be exposed to in the workplace, but on general well-being and lifestyle, the work-life balance.
I think it's very important to show people what an ear looks like, because it's probably been decades since they went to a biology lesson in school. And although those people that have had that biology lesson have probably forgotten a lot, I don't think we as human beings actually appreciate just how clever our bodies are and how delicate they are in many ways. There is a risk of noise-induced hearing loss, and not just in the working public, but also because of the advent of earbuds and iPhones and subwoofers in cars.
I don't know any other sign companies who do what we do, but we do operate in a construction industry. And whilst, for example, what we do doesn't create a lot of dust, we do work in dusty environments. We're looking at breathing issues relating to inhalation of dust or paint fumes or solvents or anything that we can come across on a construction site. We try to adopt tools that minimise the vibration, but we're keen to monitor the vibration and monitor the effect of the tools that we work with. We do, for example, display screen equipment assessments. So again, that's predominantly for the office-based people, but that stops RSI and carpal tunnel syndrome and back problems. That we are looking at their health as well. We've tried to manage stress for a number of years. We've got an employee assistance plan because stress is a big factor in what we do. An employee assistance plan is a paid-for plan that's paid for by Xmo Strata, and it gives all our employees access to a confidential helpline where they can talk about any issues they've got, whether they be work-related issues or home-related issues, and if necessary they can seek face-to-face counselling. I think face-to-face counselling is a very good way of getting out any issues anybody's got, and we're after people who have happy home lives as well as happy work lives. People who are fit, are healthy and have good home lives deliver additional benefits to work, and a happy workforce is a more productive workforce.
What we try to do is to introduce some lighter methods of educating in order to get the message across and make people laugh. And whilst the subject itself is a very serious matter, if you can get people to laugh about it, it actually can teach them an awful lot while they giggle. The purpose of bringing in this prosthetic breast today was, and we had ladies and gentlemen in the audience, but we asked everyone to pass it around to feel the breast, and we also gave them an examination leaflet that they can go home and they can practice at home on themselves, at showing them exactly how they should be feeling for lumps in the breast. Breast cancer, of course, is quite common, but it's also one of the most curable of the cancers, providing it is caught very early. So it's very important that people self-examine. We also, today, we introduced an anatomical model of testes with lumps, and we passed them round and asked people to try and find the lumps. This, coupled to the examination leaflet, we hope that when they go home tonight that they will self-examine and that they will take this very seriously. Again, this is nothing to do with occupational health, but a sick employee isn't any good to any company.
There's quite a focus on well-being as part of the work-life balance, and I think if we can get people to understand that management of their health in general is a contributory to their health at work, their happiness at work, their productivity, their ability to be safe and to continue what they're doing and go home safe at the end of the day, then that's all got to be a positive thing.
All our site staff today will be having a medical, and they will be having them every 3 years. It's a confidential medical, so we as a company don't see the results of it. The clinicians that do the medicals will talk to our employees if they've got any health issues, and we'll only be alerted if they are safety-related health issues or likely to affect the safety of the employees doing their job. This is paid for by us. It gives them a 3-year check as to how their health is. They get an annual questionnaire to see if between the 3-year medicals to see their health is. And if you were ill, wouldn't you want to know before the symptoms manifested themselves? Part of our employees' contract is that they attend medicals to ensure they're fit to work at height, to work with fast-moving traffic. I think it is the responsibility of a company, because effectively people spend more time at work than they do awake at home in general terms.
So we've been doing lung function tests, hearing tests, height, weight, blood pressure, checking their musculoskeletal, that's the mobility, to make sure that there aren't any underlying problems with arthritis or rheumatism or any joints about to go. We've looked at the health and condition of their skin, of their hands, because again, these are all potential parts of the body that can be affected by the work that they do. We take a baseline measurement of things such as their lung function and their hearing acuity to measure against that data over a period of time, so that we can spot should there be any deterioration in their health because of the work that they do.